Welcome back. I want you to take a look up at the sky. It is a beautiful morning. We don't even see a single cloud in the sky, which means it could be a great morning for a run. Maybe you've already gone on a run. Maybe you're thinking about it. But I encourage you to take advantage of this great weather. And that's exactly what we're going to talk about this morning. Not the weather, but the running. So this time of year, as we said, a great time to go out and run. That's a great thing to do for not only for your body, for physical activity, but also helps mentally too. And we've got a doctor who's talking with us this morning about it. He's a chiropractor and pain specialist. This is Dr. Blessen Abraham, and he's joining us outside of the studios this morning. And doctor, you were joining us to not only talk about some techniques, but also just to talk about injuries with running. So how common is it to get injured while running? Speaking for myself, it happens a lot to me.
Injury is very common to happen when running. You'd be more surprised to be running and getting injured as you're walking away or just sitting down. That's how common it is. So it really is a proper technique and proper equipment. Proper shoes, proper clothing is all needed when you want to go running properly without getting injured.
I think I could learn a thing or two from you. I suffered from plantar fasciitis last year from running. My hip always gets out of whack, so I'm happy that I have got this interview with you this morning because I need some tips. But I also want to introduce our runner this morning. She's going to be demonstrating some things for us. This is Dawn McGinnis. Thanks for joining us this morning, Dawn.
Thank you.
And so, doctor, let's start with how you are going to help us stay clear of injuries. You have a runner here. That's what I said. We have Dawn.
Yes.
So tell us maybe with some demonstration how we're going to stay preventing injuries, how we're not going to get injured while running.
Before we start running, I would recommend doing stretches. The stretches are one of the best things to do before you do any kind of active exercise. So a couple exercises or a couple stretches we could do is a lunge.
Okay.
So an active stretching, we just take our foot, bring it forward, take our arms, and actually rotate to the open side.
Ooh, I can't rotate the whole way. I don't feel like hear you, but Dawn's doing a great job of it.
We hold that for about a 2 count, and then we switch. Other leg forward, arms out, and stretch the other way.
Okay.
And hold that for a 2 count. And just do this about 3 or 4 times before we actually go to our next exercise.
And what all is that stretching out?
Your lower half of your body. So you're stretching out your hamstrings, your piriformis, your glutes, and your core.
All right, so we want to stretch. We've got Dawn, who's been running for about 6 years. I actually think she's going to run a little bit for us, which leads me to my next question. You said quicken your stride.
Yes.
What do you mean by that? How can we do that?
A lot of people, when they run, they try to take long strides, meaning long gaps in their plantation, right? So what we want to do is do smaller steps.
Okay.
So quicker strides. So smaller steps, quicker strides, less prone to injury. We're not overstretching.
So maybe, Dawn, do you want to maybe give us a little jog and he'll tell us if your strides are looking good?
Sure. Okay.
Just have her run to the end of the parking lot here. What do you think of those, Doctor?
Very good. Very good. She's not trying to do a marathon or trying to do a fast race here, so she's doing a good stride there.
And Dawn's been running for 6 years, so she's probably pretty good at it by now. But this is the kind of stride you want to see, right?
This is the kind of stride you want to see, and you want to see a stretch before this and a stretch after she's done running.
And let's talk a little bit about posture. What do we think of Dawn's posture?
It's not bad at all. And she's pretty upright.
You were really studying her there. I like that.
Yeah. Her her head is back. It's not tilted forward. Shoulders in the right position, hips in the right position. She's in a good position.
Okay, so you want to make sure you're upright, you're not looking down.
Correct.
You're looking straight
ahead, not looking at your feet, which you tend to trip over.
And something that lots of people probably don't know is you're saying use a foam roller. So not only do you want us to stretch, but you also want a foam roller with that stretching?
Yeah, foam rollers are great. They break up tissue adhesion to your muscle. You know, running and massage and all that stuff is great, but sometimes a foam roller can really break it up for you.
And they can be really uncomfortable, but you're telling us it's good pain.
It's a good pain. It's a very good pain to have.
All right, well, thank you so much. These are definitely tips that I'm going to put to use. If people want more information, where can they go?
They can call us at the office at front desk. Email us at frontdesk@premierpainpa.com.
Awesome. Thank you so much. And thank you so much, Dawn, for joining us this morning. I think I'm being told to run away. Would you like to run away with me?
Sure.
There's pressure on me now, though. I got to have that short stride and the good posture. Okay, let's go.